Do 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 da 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 da.
Maybe this is how we open the show, with you singing Blue Moon.
You want to do that?
I think we're doing it.
Actually, let's do it.
Okay.
Okay. Blue moon, you saw me standing alone, without a dream in my heart, without a love of my own. Well, come on, I'm taking some singing lessons, but I don't always know how to sing, but I do know how to answer questions on my podcast.
That's a different way to start.
Absolutely. I'm taking singing lessons. That's one of the songs I'm learning to sing. You know what? It takes a bit of time to get there, but I can do it. I used to sing years ago.
Right. You're listening to Stay Well with Dr. Zorba. You knew that. Actually, you're listening to Blue Moon.
Stay Well. Da, 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 da,
we might get sued for that.
I got to do Stay Well lyrics to Blue Moon. There's
go.
the answer.
Anyways, I'm Karl Christensen. I'm across the desk from the one and only Zorba Pastor.
The only
Dr.
Zorba
Pastor.
Pastor. That's right.
All right.
That's right. That's right.
But
I am taking voice lessons.
You are.
Well, I want to learn. I'm trying to figure out how to basically preserve my voice. I mean, we do exercise, right, for our body, physiological exercise. We do exercise for our heart. We eat well to make sure our arteries and stuff, but we don't always take care of our voice. Mm-hmm. And I'm actually taking speech and voice lessons because I want to keep my voice young and vibrant. And as you know, when people get older, their voice tends to go down. They become quieter, becomes a bit more gravelly. And the fact is, I think you can do more for it. I actually am doing that. And let me tell you, by the end of this year, I will be singing. I won't be singing like Frank Sinatra, but I will be singing better than I did just now.
It's good.
That's my goal.
It's good to have goals.
I got to go.
Sure.
Short goal. Be better than now. That's the short goal.
I love it. Let's talk about our show today. Zorba's gonna talk about this new trend of getting full body
Too
MRI
many MRI
scans.
scans. What are they about? What's the downside? You think there's no downside? There is a downside. We're going to talk about that.
All right. Zorba's going to help out a caller. We'll get to some of your listener emails. My mom's going to tee up one of her famous mom jokes. And if you have a question for the good doc, call this number anytime, 608-492-9292.
That's right. And you can email me at askdrzorba@gmail.com.
Let's get right into our healthy living topic. According to leading radiologists, elective MRI screenings are not recommended and can actually do some more harm than good.
This is a big issue. This is not a small issue. So there are false positives and false negatives. So false negative is you get, we'll say, an exam, like you might get a mammogram, and it doesn't show any cancer, and then 3 months later, 4 months later, it shows cancer. So it looked negative on the mammogram, but there was cancer there. A false positive is you get a lump. I'm giving an example of a mammogram, and they go, well, we don't know if it's cancer, and we have to go and do a biopsy, and then the lump turns out not to be cancer. So that's a false positive. Looks positive on the test, nothing's there. So MRI scans have lots of false positives.
Okay.
In other words, it's an exam that picks up many things that will not bother you. So this is a really important point. It seems sort of counterintuitive. The idea is, well, I'll get an MRI scan of my whole body, and anything that's abnormal, they'll be able to pick it up before it bothers me. Well, it turns out you've got lots of abnormal things that never grow and never bother you. In other words, you might we'll say there might be something in your gut, in your colon, in your breast, in your skin that says, well, we don't really know if there's something there, but doesn't look normal. And all of a sudden, you have a series of tests. You may have an early test, it might be aggressive intervention, and it may turn out that you don't have cancer. And in one study, this is an interesting quote about the study. In one study, attempting to demonstrate the benefit of ovarian cancer screening, okay, that was the question. It was an attempting event to see about ovarian cancer screening because we do not have a screening test for ovarian cancer, okay? There have been a number of tests that were ovarian ultrasounds to see whether or not if we did an ultrasound, which is an relatively inexpensive test, and it turned out we didn't change the morbidity or mortality of ovarian cancer. We didn't save lives. So one test, they said, let's look and do MRI screening for ovarian cancer. 212 women in this particular group were diagnosed with ovarian cancer, okay? But compared to the group that did not screen, there was no difference in how long they lived. So in other words, a number of the women who looked like they had ovarian cancer did not have any abnormality in their ovary that was going to grow and kill them. But 1,000 women underwent unnecessary surgery to find this particular thing, but there was no difference in how many women lived and died. So in other words, even though they discovered some ovarian cancer, those women who were going to die, it was too late to discover it in the first place.
Right.
And for 1,000 women, it was, oh my God, I have ovarian cancer. We're going to have surgery. You have surgery. Removed it. And thank God I don't have ovarian cancer. That is the false positive.
Okay.
And body MRI scans have lots of false positives. And that turns out to be a great big giant issue. And so even though they're going around the country and saying, hey, because it's not paid for by insurance.
Right, and they're expensive too, right?
Couple $1,000s. That's
$2,000.
usually what they cost. So a couple $1,000s to find things that don't cause problems.
Sure.
Like, oh my God, look at your left kidney. There's a cyst there. All of a sudden you go down the rabbit hole to discover the cyst doesn't cause you problems. So when we're looking at screening tests, those are really the important things. You want to look at screening tests that have been shown for cancer. That's what people are most interested in for benefit. So, colon cancer screening tests, they're a benefit, okay? Regular mammograms, they're a benefit. That's it.
That's just the two?
That's it. They've tried, if you look at the PSA test for prostate cancer, may be a benefit. That's number 3. May not be a benefit. It depends on which side of the case. If it's marginal benefit, okay? That's PSA, so that could be a benefit. There's no screening test for lymphoma. There's no screening test for leukemia. There's no screening test for kidney disease. There's no screening test for pancreatic disease. There's no screening test in the U.S. for stomach disease. There's no screening test for all of these other things. Now, if you go to the doctor and you have a physical and they discover that you've got lumps in underneath your say your chin, then you would get that biopsy to see if you had a lymphoma. But if you're washing your face, you would feel a lump in your skin and you would say, what's this lump doing here? It's getting bigger and bigger. There's no screening test beyond your ability to actually notice something like that. So the MRI tests give a lot of false negatives. In other words, and they cause problems, they cause extra money you're going to pay for, and they're worthless. Do not get them. And the people who are going across the country selling you on them, I think they're not exactly snake oil salesmen and saleswomen. I don't want to be sexist, but they really are selling snake oil.
I had a question about this. So is this an American thing? Like, are we just over-screening ourselves? Like, does this happen in Europe as well, or is this...
I think it's kind of an American. I think we're neurotic about our health.
Okay.
Are we more neurotic, certainly, than a lot of Europeans? Yeah. I think we're
over-screened and over-tested.
I think we're over-screened and over-tested because we do that. We're very technologically oriented. We want to get a test. When you come in, you see the doctor. If you have a physical, you expect blood tests. Mm-hmm. But if your doctor says you're fine, you'll say, yeah, but what about all those blood tests? What do they mean? And if you have 20 blood tests and one of them happens to be statistically somewhat abnormal, people then go, well, what about that test? That's abnormal. Even though the test may be out of normal, it may not be abnormal. So yeah, we are a test-oriented society, and that's who we are. That's what it means to be American. I am proud
to
of
be
it.
tested
That's right.
and screened.
We should have a song. We need a country and western song that says, proud
country
to be
an
American. We like our tests.
A lot of songs you're asking for.
You know,
right now.
You're a songwriter.
Right.
You could write a song about it. You know what? You ought to write a song.
Another song assignment.
Proud to be American. We love the technology.
I'll look into that one.
You'll get back to me?
I'll get back to you on that one.
Or you'll have your girl get back to my girl?
Yeah, my people will get back to your people.
Sexist. Your people will get back to my people.
All right. If you have a question for the good doc, call the hotline 608-492-9292.
Email me at askdrzorba@gmail.com. And remember the website, drzorba.org.
All right, Zorba, let's see if you can help out a caller. This is a voicemail somebody left us. And that's actually, let's tell people about the process. If they call this phone number, a lot of times you leave a voicemail.
That's right.
We listen to them and we get back to you.
Yeah.
And
right.
so you're not, right on the podcast right away. And if you want to be on the podcast, you let us know and we'll call you back.
Right,
And we'll
right.
get, you talk to Zorba, or we just treat it as a voicemail.
Or we treat it just as
no
a
pressure
voicemail.
at all.
No pressure.
No pressure.
608-492-9292. It is the pressure-free telephone number of the year.
Pressure-free hotline. Is that an oxymoron?
Yeah, I like it though. Pressure-free hotline. I like
it's
it.
like a mild line.
It's okay. Yeah.
Let's see if Zorba can help out a caller from Wisconsin.
We were talking about peanut allergies, and the guy was saying about the difference between boiled ones and raw ones or whatever. And I thought that the peanut allergy was actually not to the peanut, but to a fungus that grows on the peanut. Could you research that a little bit and come back to that on the show? Thank you.
Peanut allergy is to the peanuts. It's not to
the
a fungus. Not the fungus that grows on the peanuts. It is the peanut itself. And for many years, we've said don't give peanuts to kids early in life because if you do, you might be causing an allergy. And the answer was it is exactly the opposite. Mm-hmm. You want to give your kids peanut products like peanut butter or peanut crisps, which are just like sort of Cheetos that are made of peanuts early in life because it reduces the risk of actually getting a peanut allergy.
Interesting.
It turns out that when we, especially in families that are more likely to get an allergy, that when we held back peanuts, they are more likely to get a peanut allergy. So give your kids peanuts early on in life. You can buy it. You can buy them. They're like, they say they look. Do you like Cheetos?
Oh, geez. You're asking, yeah.
You're
asking the right guy. I love Cheetos.
I love Cheetos. And I look at it in my hand. I think it's iridescent stuff on my hand. Talk about an ultra-processed food. It defines an ultra-processed food.
Can I shame myself for a second on the podcast?
Please.
I've never done this before, but I did this last week. We got a bag of Cheetos.
Yeah.
And I decided I don't want to have Cheeto fingers, like orange fingers. Yeah. So
they are orange.
What I did, I poured them into a mug, like a coffee mug, just a little portion. Maybe it's good portion control for me. And I just drank Cheetos out of a mug. And then it didn't get all over my hands. Should I feel really bad about this?
No, you should feel really good and do a TikTok on the whole thing.
Okay.
That's it.
I'm not on TikTok.
I know, but how to keep orange? People will want to know how to keep orange off their hands when they're
drink
eating
them.
Cheetos.
Just drink your. It's like when at the end of the bag, you ever do that with the bag? You lift the bag up and drink the bag.
I'm with you. It has nothing to do with the question that we're answering, but I'm with you. Getting back to peanuts.
Please do.
Getting back to peanuts, there are peanut products now all over that you can give it. You cannot give a peanut to your child because when they're babies, they're going to choke on them, and you can't do that. But you can give a peanut product such as a crisp, a Cheeto crisp, and there are a number of them. Bamba is the one that's on the market that I think about. That's the one that was present in Israel where the first studies came out. Give your child peanuts early in their life. It is from the peanuts that we're allergic to, not the fungus.
All right, Zorba, let's take a listener email. The following message came from Greg in Sun Prairie, Wisconsin, who writes...
Hi, Greg.
Hey, Greg, you listening? How's Sun Prairie? It's pretty close. It's basically Madison.
How's Sun Prairie? Yeah. That's right. That's right. How's Sun Prairie?
How's Sun Prairie? All right, Greg writes, I'm a 67-year-old male, and I've had back pain on and off for the past 30 years. I think it was caused from lifting heavy objects, a few minor car crashes, and 26...
Wait a minute. A few minor car crashes.
Few.
How many minor car crashes have you had in your life?
Maybe one or two, maybe. Just little fender benders. The fender benders.
Fender bender doesn't count. No, car crash, I think of more than a fender bender.
Yeah, I suppose.
Something that really gets your body moving more.
Yeah.
So,
maybe Greg will email.
That's important. Few minor car crashes.
Yeah. Mm-hmm. And then Greg says, in 26 years of a stressful, sedentary office job, not good for your back usually, it would go out 3 or 4 times per year at least. Previously, when my lower back basically seized up, I would take Flexerol for a few days, and within a few more days, I would be back to normal. Now my back has been painful for the past year. Nothing works. PT, stretching, walking, biking, TENS unit, heat and ice, acupuncture, chiropractor, massage, etc., etc. The MRI confirmed a disc bulge, and the L4, L5 area is the usual trouble spot for me. I'm considering a cortisone shot and possibly surgery. Any advice on this? I know back pain's hard for.
Well, back pain is always hard. So the usual thing we say for back pain, you want to do some sort of exercise, which he's done. Yoga can sometimes be helpful. Massage, acupuncture. Sounds like he has done.
He's tried a lot.
All of those. I always tell people, if you've got severe back pain, give it 12 weeks, 14 weeks before you look towards an injection. I think if it were like this, it sounds like an injection would be warranted to see whether or not that would make a difference in that. I'd be very careful before I would actually have surgery, but I certainly would consider an injection. Now let's look back. What medications besides Flexeril did he talk about?
That was the only one I saw in the email.
Right. So I would try gabapentin. Gabapentin is an excellent drug for low back pain, especially for neuropathic low back pain. That can make a huge difference. 100 to 300 milligrams 3 times a day, because the Flexeril used to work. It's a different drug. It works as a muscle relaxer, but gabapentin can be excellent. Also, anti-inflammatories, 500 milligrams of naproxen twice a day. I'd give that a 3-month trial. Or meloxicam, another one, 15 milligrams daily for about 3 months, because sometimes an anti-inflammatory can make a difference. Sometimes just a dose of steroids for 2 weeks can make a difference. 10 or 20 milligrams of prednisone once or twice a day for 20 milligrams twice a day for 1 week, 10 milligrams twice a day for 1 week, and see whether or not that would do. There are a number of things you can do that it doesn't sound like you've done before you get an injection, and I would try those oral medications first to see what happens. But then again, you've got to look at the long term, what's going on, and then you've got to sit down with the clinician and say, is there a drug that's going to keep me functioning? Because surgery should be the last thing that you consider.
All right. Have a healthy living question for the good doc? Just post on our Facebook page. You could email askdrzorba@gmail.com.
Or call me at 608-492-9292.
92.
That's 608-492-9292. Okay, Karl, we talk about how much we both love coffee, and it doesn't hurt that there are health benefits to drinking coffee as well, which is why we're partnering with Just Coffee Cooperative on this podcast.
Just Coffee Cooperative is committed to transparency with their online coffee tracker. You enter the code on your coffee bag, and it tells you the country of origin, the roast type, the roast date, how much per pound was paid to the grower, and you can even view the contract under which the green coffee was purchased.
And guess what, listeners? If you use the code Zorba10, you'll get 10% off your entire order on their website, www.justcoffee.coop. Just Coffee Cooperative, justice from the grounds up.
All right. You know my mom.
I do know your mom.
And you know her through her jokes.
I knew her.
Okay.
And we got another joke.
Yep,
and she
here
has
we go.
An infinite number of jokes.
You set this one up. Can you set up the mom joke segment? Because I always set it up, but I don't know how to do it anymore.
So, you know, you don't know how to do it. You've been doing it for years. So mom jokes are different than dad jokes.
Yeah, how?
I don't know. I don't really understand. That was my setup. Go ahead.
It's a good setup.
Run the music.
Okay, I'm going to hit
Run
the button.
music.
Here's a
Go
mom
for
joke
it.
from my mom.
That's as good as it gets.
Yeah.
Why did Frank Lloyd Wright have such slow internet in his home? Because he was using a mid-century modem.
That was good.
You like that one?
I like that one.
Architecture
I like
joke.
that. I
Mid-century
like it.
modem.
I like it.
Ah.
I like that. I like that. That's right.
Let's do another listener email. This is from Molly in Middleton, Wisconsin, who writes,
Hi, Molly.
Hey, Molly. Hey, Doc and Karl. Recently, someone who emailed the show said that they were told that concentrated lemon juice will obliterate kidney stones. And while that sounds pretty extreme, and you were right to question it, you might have been hasty in disregarding it entirely. Mm-hmm. I've found that there is some truth to a version of this recommendation. I've experienced kidney stones 3 times in my adult life. I became very frustrated when my doctors couldn't even tell me what I might do to prevent them other than drinking a lot of water, which I already did. Eventually, I was given a list of foods to avoid, but they were some of my favorite, healthiest foods. Beans, nuts, spinach, strawberries, oranges, coffee, chocolate.
Where Where did she get this list
I don't
from?
know.
I don't get any list to
These are
avoid.
calcium oxalate-rich foods,
Yeah,
what she
but I
writes.
don't know if there's any evidence that they really make a difference.
Yeah. So anyway, she goes on. Then one day,
There really is no stone diet. I
No?
just want to get there. There is no stone diet.
There's no stone diet.
But keep going.
Then one day, my mother-in-law, a nurse, read that drinking water with lemon juice in it when you are eating foods high in oxalates will help break the oxalates down, allowing them to pass more easily through the kidneys. So I started doing that, and voila, I have not had kidney stones in 23 years, and I'm eating all of those wonderful foods again. The moral of the story? It's okay to occasionally say, I hadn't heard of that, we should look into it. You do say this periodically, but no one expects you to have all the answers right at your fingertips. Thanks for your show.
Well, first of all, she's right.
Right.
And also, this has worked for her, and that may be why it worked. On the other hand, sometimes you have kidney stone and you don't have it for 20 years. So I've had kidney stones, and I haven't had it for 35 years, and I'm not taking lemon juice, and I haven't changed my diet at all.
Right.
And I haven't had it. So they are random things. And remember, I mean, I know that I don't have all the information because, frankly, nobody has all the information.
Sure.
Even if I were super smart, which I'm not.
Oh, come on.
I would still not.
I would sell yourself short.
I would still not have all of the information.
I think there's a lot of people listening who would argue with you about that statement. You are super.
But I mean,
come on.
But I wouldn't have. But the fact is, it may work, and it may work for that person. And when we look at numbers and studies, we look at if something works for, we'll say, 10 people, and it doesn't work for the next 10 people, then the answer for the study can be 0. It doesn't work. So in other words, sometimes when we look at population studies, it doesn't tell whether or not it works for individuals. Good example with food. Food at one restaurant, you may go to a restaurant and you love the food because it's hot, and somebody likes the restaurant because the food is not hot. I mean, it doesn't mean that restaurant is good because it has hot or non-hot food. It means because it has both. It's the same thing with science. Sometimes we can't find an individual. So in her case, yes, she should continue with it, and maybe it'll be that way, and she should write us for the rest of her life because we'll be doing this podcast forever.
This seems like it falls under the no harm, no foul, which I've heard you say quite a bit. If it's
I
working,
think so.
If it's
No
working
harm,
for you and
no
it's
harm,
not
no foul.
expensive and it's not
let me
hurting
tell you
you.
something. It's good to have a sports motif on the show. No harm, no foul.
Yeah.
What was that from? What is it from, though?
I would think it's basketball. I would
basketball.
think.
How about hockey?
Are they called fouls in hockey? See, I'm not a hockey
How about
person at
football?
all. Football, it's a penalty.
It's a penalty. So it must
Foul
be
is basketball. I don't
Got
know.
it.
I'm sure there's
Got
fouls
it.
in other sports
Got
too.
it.
And write us
How
if
about
you have
how about rugby?
rugby. That's probably a foul. I don't know.
How about lacrosse?
Lacrosse. See, you're doing all these sports that I don't know much
How
about.
about soccer?
Soccer.
Soccer.
There's a penalty kick,
Yeah.
but there's a foul. I think
There's a foul in
both
soccer.
in soccer,
Yeah.
right?
How about life?
Should we just leave that there?
No foul, no harm.
You stumped me. We got
That's
to
the
end this
game.
show. We got to end this show, please.
All right.
Oh, what did we learn today? We talked about those full body MRI scans.
Yes.
Yeah.
And how they are not, I would not recommend it at all because it has a good chance of picking up things that are not likely to affect your health and may cause you to go down a rabbit hole that you don't need to go down. The false negative rate is too high. Or false positive rate is too high.
Yep. And we talked about peanut allergies, back pain. We heard an architecture-centered joke.
Yes, that's right.
And we talked about lemon juice for kidney stones.
That's right.
Yeah.
That's right. Lots of good
Learned
stuff.
a lot.
Listen, folks, call me at 608-492-9292. I'd love answering questions. You could be on the show or not on the show, but we'd love to hear your voice. Email me at askdrzorba@gmail.com. And don't forget to stay well.